Are you looking for awareness, motivation, inspiration, or just some feel-good talk radio? If so, you've come to the right place. Dr. Nancy knows how to do just that. With her extensive experience and knowledge, she is dedicated to providing care, health, and wellness information and education to the greater Phoenix metropolitan area and beyond. Be the change you wish to see in the world. Dr. Nancy knows. Starts now.
Good morning, everyone. I'm your celebrity medical doctor, and this is Dr. Nancy Knows Radio Talk Show. Happy New Year. How has everybody been? It's been a long year, 2020, and there's been so many things that we can look back on and be grateful to. There's been a lot of changes in our country, and now is the time more than ever to come together. What are your New Year's resolutions? Do you make any? Have you been reflective? What lessons learned has life taught you and that you want to instill in your life? 2021 is going to be a phenomenal year. I feel that it is, and you should as well. We're blessed to be here. Really, I thank you for tuning in every Saturday morning at 9 to hear, what I have to say and bring to the audience, the viewers. And listen, if you have questions and or concepts and ideas of topics that you'd like for me to talk about, you can send those requests right to me. Facebook Live. We're on all social media outlets. drnancyknows.com, live streaming, eMotion Radio, Facebook Live, TuneIn, Spotify, podcast, yes, as well as Dr. Nancy Knows YouTube. Be the change that you wish to see in this world. It only takes one, the power of one. Here at Dr. Nancy Knows Radio Talk Show, we bring on expert guests weekly, experts in their field of industry, to really talk about relevant topics that matter to all of us. Remember, we're internet radio, and so that's not just locally here in the Phoenix metropolitan area, but it's nationally and internationally. We bring on celebrity guests once a month as well. And as you know, our viewers here, our guests, they all need to be really doing something in the community and making a difference. And this show is no exception this week. Our guest is Kimberly Van Ray. She is a recovery expert, registered nurse, 25 years of experience in medicine. She's going to come up next and tell us, why it's so important to bring awareness to the disease of addiction. And I can't wait. So call your friends, let everyone know that Kimberly Van Ray will be up on our next segment to give us some insights on her journey and what she's doing to give back in the community. I'd like to thank our sponsors of Dr. Nancy Knows Radio Talk Show: Sonoran Oral Facial Surgery, Maggie's Makeup. If you like my makeup, she makes me up every Saturday morning before the show, and I feel wonderful inside. It's just the small things that individuals can do, or you can do, to uplift your spirit, to actually bring enlightenment into your life. That actually stimulates endorphins to make you feel good. And if you like what she does to me, then she is a part of our team and is accessible as well. So Dr. Nancy's Integrative Medicine, if you want Maggie's Makeup for any type of special event, weddings, quinceañeras, just give us a call at 480-669-6452. Profit Laser Lipo with Gary Charlson is another one of our sponsors. Beauty with a Motive. Gloria Guerrara, She is our bilingual HR and insurance benefit specialist as well. I'd like to thank Emotion Radio as well, Entre Mujeres radio station, for bringing us live every Saturday morning. Behind the scenes, my team is awesome, and I don't expect anything less going into this new year, 2021. So grateful to have them here as a part of my team. We are multicultural here at Dr. Nancy Knows Radio Talk Show, and that bridges the gap of disparity and unites our nation as a one. We also are, taking requests and considerations for expert guests in their field of industries as well. So if you'd like to be a part of the Dr. Nancy Knows Radio Talk Show, to have, a segment here where you can tell us, your story and what it is that you're doing, feel free to reach out at drnancyknows.com, and there are guest tab and showcase your business tabs that you can express your interest, fill out the contact form, and members of our team will be in touch with you. So there's all different ways to spread awareness and knowledge to the public. And now is the time. Why put off tomorrow what you can do today? Live in the present. People, we need love, we need unity, we need hope. And that's what we do here at the show, is bring the human side very current and relevant, and hopefully you can see our hearts here and what we intend to do in our quest to make a difference in this landscape as well. We are going to talk about current events. So current events, there has been a new year and new laws across our country. Starting with Arizona, most countries already have this, but Arizona is no texting while driving. And so for many of you that have been, just so you know, do not do it here in Arizona. And Virginia has passed that law as well. Delaware has passed a law for no single-use plastic bags because it really harms our environment. The landfills, increases litter. Hawaii has banned sunscreen. Actually, they don't even sell it there in that state because there is a couple of ingredients, oxybenzone and or octinoate, I think that's what it's called. Those are the two ingredients that really harm our coral reefs and environment as well. Get this, guys. Illinois has passed a law, this 2021, to say we are going to be providing $50 toward college savings accounts for all that are born in that state and or adopted. That's totally amazing. I think that bringing awareness to what not only individuals or businesses or organizations are doing, but the states need to be recognized as well. One other thing, Arizona has passed a law in March, actually, that is going to make marijuana something that individuals don't need a marijuana medical card to obtain starting March 2021. Let's talk about COVID. It's everywhere. It's everywhere in the news. It's impacted many of our lives in this past 2020, and it's still here in 2021. But I am pleased to tell you that the vaccine is here. And again, what it is proposed to do is that when you get fully vaccinated, and that's with 2 shots at separate times, your body will stimulate antibodies, immunoglobulin G, IgG, and those are the antibodies that provide immunity against COVID. Now, there are several pharmaceutical companies out there. Pfizer is one that requires special temperature freezers for that particular virus. And Dr. Nancy's Integrative Medicine has applied to the state to be able to store that vaccine. And once we get approval, Dr. Nancy's Integrative Medicine, her team, will be able to offer the vaccine in phase 3. There are 3 phases that the COVID vaccine is going to be rolled out. First phase is going to be for all hospital workers, and over 1 million of our hospital workers have been vaccinated. The CDC's goal is to vaccinate 20 million in January. Now, that is a large feat, but we are in the process as a country to resolve and bring closure to this COVID epidemic. Phase 2 is going to be for essential workers like bankers, the food chain, firefighters, individuals that are 65 years and older as well. And then phase 3, that's where Dr. Nancy's Integrative Medicine and her team comes out. The vaccine will be made available to the rest of the general population for all that want it, bringing awareness to what type of vaccine it is, what it's proposed to do, and who offers it. I believe it's my civil duty to let you all know that it will be free of charge as well. Travel. I do want to tell you that the airlines have instituted this new year, state IDs are going to be made specifically compliant with individuals that are traveling across the country. Now, military IDs and passports are all acceptable forms of ID. So all of you that have state IDs, make sure that you have the type of ID that will pass for travel as well. Dr. Nancy's Integrative Medicine has a New Year $25 gift card for all individuals that, the first 10 that sign up for health screening examinations.
Hello, this is Dr. Nancy's Integrative Medicine.
The health screening examinations include a physical examination and baseline blood work. So that would be a CBC, a chemistry panel. That includes a lipid profile and LFTs along with A1C. So now is the time, the beginning of the year, to know what your health status is. And we're having special pricing for health screenings. It's $199 for the first 10 that call, and then you will have a complimentary $25 gift card that you can use toward any further purchases. Now, we are having up next Kimberly Van Ray, Recovery Expert. She's going to share with us her journey, 25 years of experience, and what she has discovered in the role of the disease called addiction. We're so grateful and happy to have her here to share her story, and you're going to hear all about it when we come right back.
You don't want to miss what's coming up next because Dr. Nancy knows. We'll be back in a few minutes.
Hello, I'm your celebrity medical doctor, and this is Dr. Nancy Knows Radio Talk Show. We are looking for expert guests in their field of industry to include, but not limited to, finances, senior living, real estate, hospitality, entertainment, nonprofit. If this sounds like you, we want to hear from you. You can reach us at drnancyknows.com and fill out the form to be considered. Remember, it's not only what Dr. Nancy knows, but it's who she knows.
I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnanciesintegrativemedicine.com.
Hi, I'm medical celebrity doctor, and this is Dr. Nancy Knows Radio Talk Show. If you are a business and interested in showcasing your business on one of our segments on the show, to tell the viewers, listeners, who you are, what you do, and why we need to engage in your business, then contact us at drnancyknows.com. Fill out the form to be considered. Now accepting sponsorship request. Remember, it's not only what Dr. Nancy knows, but it's who she knows.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
Good morning. We are back. Again, Happy New Year. We have Kimberly Van Ray. She is a registered nurse and a recovery expert. Kimberly and I have worked together in the past, and if you all know or don't know, registered nurses and the medical professionals have a special place in my heart. Not just because I am one of those individuals, a nurse, medical professional, worked in medicine for 25 years, but because of the job itself. It requires and demands so much of you, and you have to take your job in that particular instance very seriously, because people are reaching out to you, and it's your responsibility to take care of them and be there for them in their moment. And so Kimberly has worked in medicine for 25 years, emergency medicine, recovery, addiction and rehab, inpatient and transitional care, living as well. And she is a prime example of giving of herself. She lives that every day in her real life as well. She is a dedicated mother, spouse, and she is a prime example of who you would want to be caring for you in your time of need. I'm so grateful to have Kimberly on the show. When I asked her to be on the show, she was like, absolutely, you say when, I'm going to do it. You just have to know that you feel her before she even speaks. And she's so dedicated and real. And we are going to get to know Kimberly Van Ray today. Kimberly, welcome to the show.
Thank you, Dr. Nancy. Thank you for having me.
You're very welcome. So tell us, you're a nurse, bachelor's, and please.
Yeah, so I started as a CNA, and then I went into the Army, got as a medic, and then got my nursing in the Army, got out in the civilian sector, and worked as an RN. So over 25 years in the nursing profession. Yeah.
Wow. That's great. Would you change anything?
No, I know this sounds crazy, but I almost wish that I had started an addiction way sooner. And I guess I had to go down my path to be, where I am today. But yes, I love the disease of addiction is the only disease you can suffer from, and that in a program of recovery, you are exponentially a better person than you ever were prior to acquiring the disease. And this comes from the Betty Ford clinic, the doctor that treated Betty Ford, and he didn't suffer from addiction, but he said that this is why he treats addiction, and this is why it's his specialty, because it's the only disease you can suffer from and become an exponentially better person in recovery. you can't say it about heart disease, you can't say it about diabetes, you can't say it about cancer. So it's so rewarding.
So overcoming addiction can make you exponentially a better person.
Absolutely.
That's
Absolutely.
really wonderful.
Working a program of recovery.
Well, who has been instrumental in your life in terms of mentors and the path that you chose?
My mom, for sure, she's just always been a really loving, caring individual. And, I found a lot of nurses in the Army that I thought, oh my gosh, I want to be like you. And then, getting out and you just find these nurses in your profession and you think, see one, do one, teach one, and you watch them and you think, oh my gosh, I want to be a nurse like you. I want to practice like you. I want to be caring and empathetic like you. And you just emulate those people.
That's very great. And then tell me other individuals that are instrumental in your life that have, made you and who you are today as well.
I think my children every day. They teach you. They teach you to remember to imagine and play, and I think we forget that. They say that a child laughs over 200 times a day, while an adult only 20. So they teach us to remember to laugh and have fun and create and imagine and, be authentic and, it's okay to not be perfect.
That's exactly right. Living in the moment, not taking yourself too seriously as well. And you're right, I do believe that as we become adults, and it could be related to a lot of the responsibilities that we have, but still, not taking yourself too seriously and learning how to have fun is really important for many different reasons.
Yeah, we forget to have fun, and we forget that we teach our children all the time, I think, that you can be anything you want to be. You can do anything you want to do. And then at some point we put ourselves in a box and we stop believing that about ourselves as adults. And, when did that stop being true? When, if you're not growing, you're dying, so keep growing, keep living, keep learning.
That's good. That's really great advice as well. And so tell me some of pitfalls and lessons learned in life that has made you a better person.
Wow. So I think addiction for me is near and dear. I didn't understand the disease, and over 20 years in nursing, I didn't understand it until it came from my soul. And at age 40, I found myself in trouble with alcohol and struggling with it. And I'm telling you, I looked for help in avenues that I thought were, the appropriate avenues, and I couldn't find healthcare providers that understood this disease. And when I finally did, I was like, oh my gosh, yes. And, then I was all about bringing awareness to it and, getting through the, what the chemical dependency of it is, and then, finding out that it isn't our problem, it's our poor solution. And then it's a problem born of our solution, and then, we're dealing with not just all of our problems that led us to the addiction, but also the chemical dependency of the addiction as well. And so once we get through the dependency and, cleaning that part up, we still have all those problems. And so we have to learn to live life on life's terms.
That totally makes sense. Now, how did you get help that you needed? How did you seek that out?
Well, I had been to the hospital several times in the thralls of, being, in the addiction. And I ended up in the hospital the last time, and I was withdrawing from the alcohol. And I remember the doctor coming in the room, and while I was in the hospital, my IV got infected, and I went completely septic, and my kidneys start to shut down. And when I finally came to 2 surgeries 2.5 weeks later, when I started to finally understand what was going on, the doctor came in my room and she said my lab values, and I looked at her and I said, I'm in renal failure. And she said, you tried to kill yourself, you drank poison. And when she said that to me, I panicked, because all I could think was, I didn't try to kill myself. I'm trying to live, and I don't know how. And I don't know where this voice came from, but I looked at her and I said, you are not the doctor for me. Get out of my room. And I just sat back and I just started to pray that they'd send someone who understood this disease, you know. And so a doctor walks in and, you know, smiles. This was the first smile I saw in the hospital for 2 weeks. And, you know, he says, I think you're going to be okay. And he walks out of the room and he sends a case manager who had 14 years in recovery into my room. And she hands me a little blue book, the Alcoholics Anonymous, and gave me a list of meetings and support groups in the area, and just said, you know, I have 14 years in recovery and there's hope for you too. And
okay.
Yeah.
So that's humanizing the experience and actually having relevance to it as well. I know that drinking poison, it was a cry for help, and it was rubbing alcohol, but a cry for help, and you know, you asked for it.
Yeah. And it's crazy to explain that to someone who doesn't understand, and doesn't understand the compulsion that comes with the addiction, and that I couldn't explain it to someone, you know, that hadn't gone through it well enough to really comprehend it. And so when, you know, you walk into the rooms of AA and you walk into a program of recovery, everyone understands. You know, and I say this quite often in my field of study. I say, you know, those who judge will never completely understand, and those that completely understand will never judge.
That's really great. Relevancy and the road to recovery.
Yes.
Is every day.
Every day, 24 hours at a time.
And you are doing it. So proud of you. And not only just doing it, you're helping others. You have an organization.
Yes.
And it's called Soul Addiction Recovery. And SOUL stands for Showing Others Unconditional Love in Recovery. And it's through mind, body, and spirit that, you know, you get a breakthrough, right? Yeah. It's through your trials that there's a silver lining. And what you say is addiction is a poor solution, you know, rather it's a drug or a substance. And it's not the actual problem. And with your organization, you help others that have this problem in so many different ways.
Yes, it's teaching you to love yourself, you know, and you know you cannot give the program teaches you can't give away what you don't have. And you know, when I hit rock bottom, I was spiritually bankrupt, I was emotionally bankrupt, and I was physically bankrupt, and I had nothing to give. And so, you know, in a program of recovery, you're surrounded by people who are filling your cup and teaching you how to love yourself, and you know, and loving you until you can love yourself, you know, until you have something to give. And that's what my programs are, that's what my organization's all about.
So you help others, and then you also have employment, and you work in a recovery facility.
Shout out to Soul Surgery, those my peeps over at Soul Surgery.
Yes. Yep. And so how does individuals get in touch with your services, and how do you acquire your presence and what you do?
They can go to my website, it's souladdictionrecovery.com. Tells a little bit about my story and my services that I provide, and my story tells, you know, of a story of understanding, you know, and that, you know, that the goal isn't to get clean and sober. The goal is to love your life enough not to have to use or drink.
That's amazing. Now, some of the services that you offer are completely adjunctive to individuals that have had stints of inpatient treatment and residential as well, and so now they're discharged. they may want continued consultations, right?
Yes.
And you provide a variety of those types of services.
So I offer services even to the family, to the, if you want an intervention, that sort of thing. I also will get them to a program if you need, help finding a program that for your insurance or for whatever, fits into, your life at that time, or what's the best program for you and what your trauma is. Also, I will meet you after recovery, after a detox or a residential treatment program, and help you get on the path of the mind, body, spirit, getting physically and emotionally and spiritually back in fit.
Well, this is simply incredible. So this is Kimberly Van Ray, everyone, who is, her journey was addiction later in life and has dedicated her life to helping others like her. It's an everyday process, and she can personally help those that are struggling and or need encouraging coaching processes and or companion through your journey. It's not every day that you can find the help that you need here, so close to individuals in the greater Phoenix area as well. And for those that are listening in other states and internationally, there are programs that are available. You just have to do a little bit of research, but I do want to let you know that with Kim's story, everyone has a story, and her way of giving back is selfless. She offers programs at her organization that will help you and your family get through this together. It's all about unity and seeing the greatness within you and you being fulfilled and happy enough to not pick up that substance. That's amazing, Kim. So amazing.
Yeah, it's not me, all him.
Well, again, it definitely aligns with what we do here at Dr. Nancy Knows Radio Talk Show. Your journey, everyone's journey is different, and believing in a higher calling and being called faith and deliverance, you too can do all that you need to do and purposed for individuals that are waiting for you to just walk in your destiny and your journey. And it does require that you believe in yourself enough to know that you can, because there are individuals that are critical to your success that will meet you along your way. Really appreciate everything that you're doing in the community, Kim. So amazing. And then on the side of employment, not only are you connecting with those that need help every day, families, your colleagues at Soul Surgery. Soul Surgery. Tell us a little bit about what you do there and the team, the amazing team that you have.
Oh my goodness, I've never worked with a group that was so dedicated to recovery. Unbelievable. Soul Surgery, that whole team. I'm the residential treatment nurse, so there's 2 residential treatment centers. There's one in Pinnacle Peak area, and then there's one in Phoenix, and then they have their detox, which is in Scottsdale, and then the clinic, which is in Scottsdale as well. And then they have several sober living houses and IOP houses. So it's an amazing outfit, and just the owners in recovery, even the ones that aren't in recovery, there's very few. Probably 90% of the staff is in recovery and understands. And the therapists, incredible. I mean, just hearts of gold. Selfless service among every single person in that whole organization is just amazing.
So everyone, you need to love what you do. For our young audiences, when you choose a career path, you have to love it to be the best at it, at what you do. And Kim, I do want to ask you, have you noticed an increase in your census and outreach to your services because of the current state of affairs that we are in?
Absolutely. The human condition we talked to earlier is all about connection. And then here we are in this pandemic where we're social distancing, we're isolating, and that's not what we were meant to do. And so the loneliness, the depression that comes with all of that, the mental health issues that come with that, again, go hand in hand with the disease of addiction, And, we're trying, when we drink and we use, we're trying to numb feelings. We can't selectively numb. You can't just numb depression and sadness and pain and anger. You're also numbing joy and happiness and connection and love. And so, it's difficult, but I've seen an incredible increase in people who are suffering or people who relapse in this trying time, so.
Probably even new individuals as well.
Exactly.
The loss of job and family members, the economic status has been greatly impacted on COVID, and just coming off the season this time of year, actually, suicide is really at its height this month, actually.
Yes, and we don't understand what it's doing to, us as a whole, our children even. We're not meant to be separated, not playing with other little kids, not at the park, not going out, not participating in sports and activities that, all are great stress relievers. And it's interesting time. And, I think that, we're working really hard to acclimate to this and still do it in a healthy fashion. So.
Well, what are some of the telltale signs that you would say, in your professional opinion, that would, clue in to someone maybe having an addiction that's worsening or not really great?
For me, it was, having to have a drink to get right, or to get straight, or to one or two wasn't enough, or just physical signs, of malnutrition and just the feeling that I need a drink. It's not, I want a drink, or you're drinking more than a couple a night, or you're drinking more, or you're using drugs or things to, that are illegal substances, and trying to feel something other than what you're feeling. You have to start questioning yourself. Okay, do I have a problem? Why am I doing this? What are my motives behind what I'm doing?
Is it hard for people to seek help?
Oh, absolutely. You're shackled by shame. Oh my goodness, someone will find out I have a problem. I can attest to that. I was definitely that person I didn't want anyone to know that I was struggling. I didn't want anyone to know that I had these problems. I didn't want anyone to judge or to see me as anything but, amazing, and I don't think that's abnormal. I think that we all feel that way. We want to be loved, accepted, and seen and respected.
Absolutely. I know that taking the first step is often the hardest, but once you do, and you're in good hands in terms of a treatment facility, is always the first step, and calling someone or a family member is really awesome. We are out of time for this one segment, but we will be back with more from Kimberly Van Ray, the recovery expert. We'll be right back.
You don't want to miss what's coming up next, because Dr. Nancy knows. We'll be back in a few minutes.
Hello, I'm your celebrity medical doctor, and this is Dr. Nancy Knows Radio Talk Show. We are looking for expert guests in their field of industry to include, but not limited to, finances, senior living, real estate, hospitality, entertainment, nonprofit. If this sounds like you, we want to hear from you. You can reach us at drnancyknows.com and fill out the form to be considered. Remember, it's not only what Dr. Nancy knows, but it's who she knows.
Hi, I'm Dr. Nancy. Welcome to our clinics. We believe that personalized care and relationship building are the basis of improving health outcomes. At Dr. Nancy's Integrative Medicine, you gain healthcare providers who take the time to understand your health goals and find solutions. We offer optional medical memberships, giving you peace of mind and quality care. We provide both medical and aesthetic services in 2 Arizona locations. We practice the highest standards of patient care. We respect patients' rights. We safeguard patient confidences. We treat patients with compassion. You are invited to call the office to schedule an appointment or online at a time that is convenient for you. Call to schedule 480-669-6452 or visit our website at drnanciesintegrativemedicine.com.
Hi, I'm Dr. Nancy of Dr. Nancy's Integrative Medicine. I'd like to tell you about a service that I offer, ProFit Laser Lipo. Did you know that you could lose up to 2 inches in 20 minutes, no downtime, pain, or surgery? 8 sessions are recommended for maximum results. Call today, 480-669-6452, or schedule online at drnanciesintegrativemedicine.com.
You're listening to Dr. Nancy Knows Radio Talk Show. Ask your questions now. Dr. Nancy is listening.
We are back with Kimberly Van Ray, Recovery Expert Registered Nurse, and we are just going to pick up where we left off with regard to addiction, bringing more awareness to this disease, and how shameful it is for individuals, they feel this way, to seek help. And Kim is going to talk to us about when individuals, when do they know when to seek help, and what are those steps? What does that process look like?
Well, it's first understanding that your life is unmanageable. You know, when you drink, your life is unmanageable. Drink or use, whatever that substance is. And if your life becomes unmanageable, you know, you break out in handcuffs every time, you know, you drink or use drugs, then you're probably having a manageable life, or you're just drinking too much and it's affecting your life and you're not productive. And you know, the only requirement for membership is a desire to stop drinking, you know, or to stop using. So it's just about, you know, understanding that you don't want to live this sort of life anymore, and that you're just sick and tired of being sick and tired.
All right, so then an individual go into maybe the ER to sober up and or to recover, and then consultation actually can sometimes take place in the hospital setting to decide inpatient versus outpatient treatment, and an individual will choose that process, and then what happens?
Well, you know, you usually look into whatever insurance you have, and then where you can go, and then call that recovery center. And I know for soul surgery, we take it from there. There's no more thinking. We understand that your life is unmanageable, and so we are going to take care of it from, you know, start to finish for there. But you know, and as my company, Soul Addiction Recovery, same thing. Like, I'm going to figure out where you can go, what your insurance will accept, or, you know, if you have insurance, how to get insurance, all of those things, and then how to get into a treatment facility that fits your needs.
Well, that's really great information, because there may be individuals that are thinking, okay, I have this problem, now what? How do I get the help that I need? Mm-hmm. So thank you for sharing that information as well.
Or to even just go to a meeting, find a local meeting house, and go to an AA meeting and say, does any of this apply to me? You know.
That's great information. That's really wonderful. Now listen, congratulations are in order, I do believe, Kimberly. I want to congratulate you, won first place at OCB Masters Division Bikini. Tell us about that. Congratulations.
Thank you. Yeah, so I started exercising and working out. That was part of my the mind, body, and spirit, and you know, started lifting and really liked it. And I had a couple girlfriends who had competed before, and one of my girlfriends said, you know, you really could compete and win. And so I I committed to it, and I, did the work and followed through, and I took first place in the Masters Division, amateur bodybuilding bikini division.
Wow. Wow. Now that's dedication and determination, right? And I believe that when an individual makes their mind up, it's mind over matter, by the way. Mindset is everything. And when an individual decides to do something, they can do anything. It's limitless.
Yes. Yeah, and it's crazy because the program of recovery actually helped me intensely with, my body part, the working out and the bodybuilding, because, I believe that life is like a gym membership with a really complicated cancellation policy. And, so we are forced through trials and things that are heavy, and we lift heavy things, and so weightlifting is lifting heavy things and becoming stronger, and embracing the suck, the pain, and being uncomfortable and staying uncomfortable for a little bit, and building muscle that way.
Well, supplementation, overall health and well-being, not just mentally but physically and spiritually, is all important for balance.
Yes.
And I believe that it's really important for an individual that wants to make a difference. They need to make a difference for themselves first and love who they are and the skin that they're in. And when that happens, people see who you are, and you have so much more to offer and give back when you love yourself.
Absolutely. You cannot give away what you do not have. And
That's
so
really
in order
great.
to love someone completely, you have to love yourself.
That's exactly right. Well, listen, I am super grateful to have you on the show to talk about the disease addiction. And I hope that all of you, my viewers and listeners, have gotten some great information from what Kimberly shared with us today. And she is available to help all that need her services. And Kimberly, how do we reach out to you if we have concerns and want to know more about what it is that you offer?
So my website, obviously, at souladdictionrecovery.com, and you can contact me through that. You shoot me off an email through my website. If you're looking to get into a recovery center, you can shout out to Soul Surgery. Brian, my business development people out at Soul Surgery will take care of everything you need there, or direct you in the direction you need to go. But yes, definitely my website, souladdictionrecovery.com.
Very good. And the message really here is you're not alone.
No, you are not alone.
You're not alone. There are people that care about you as well. Until you can start caring about yourself, and that's the wonderful thing about the human race and individuals that are in fields of the industry that they're experts in, because they have a passion and to love and care and give back in that same fashion. And so, yes, you are not alone.
Yeah, and I think when you hit rock bottom and you go through what I've been through, it's this great honor of just living life, but with great honor comes great responsibility. So, you have to be reaching back and helping the next one in line.
That's exactly right. So we call that a hand up, right? Not a handout, but a hand up. And giving people hope and humanizing the experiences and letting you know that it takes all of us together as a one unit to change the world. Starting with one, though. It can really just start with one. So be the change you wish to see in the world. So we really thank you for being a part of the show, Kimberly. And listen, guys, our segment, Boost Your Awareness, thereby increasing your health and wealth, is a segment that we talk about helpful tips on health and wealth. And so with this segment, we're going to keep Kimberly around to talk about some of those tips on the health side of things, Kim. What do you have to say in terms of just overall health and well-being, and not necessarily always related to the medical profession, right? You know, inspirational words of wisdom and motivation increases those endorphins, so it makes you feel good about yourself. So that's an overall health and well tip. What tips do you have for us today?
Well, you know, one of the greatest things that my trainer said to me when I was training for the show was, you know, she never called it a diet. She always called it an eating plan. How's your eating plan going? And, you know, when we first started, I said, well, I cheated. She said, I don't like that word, define cheated. And I said, you know, I ate a handful of M&Ms. And she says, well, did you need those M&Ms? And I said, define need. And she said, well, sometimes your body just needs calories, doesn't care how it gets them. You know, so, you know, did you need them? And I said, no, I cheated. And she says, would you cheat on someone you love? And I said, no. She says, would you like it if someone you love cheated on you? And I said, no. And she said, then why are you cheating on yourself? And so, you know, I thought about that every time I picked up something that wasn't on plan, or that, you know, do I need this? You know, so that was really great advice. You know, do I really need this and how am I going to feel after I eat it? You know what I mean? Or whatever. So it was, you know, pretty deep, but very helpful for me, because then every time, you know, like I said, I pick something up, I'm like, do I need this? Is this good for my body? Is it feeding my body, my mind, my soul?
That's a really awesome tip, and it's so timely because it's the beginning of the year, everyone. And, you know, we're all trying to shed off some of those holiday pounds that we may have put on. And New Year's, Valentine's Day is right around the corner as well. And so New Year is a new beginning. And what a great tip to just really get your mind right with whatever program that you decide is best for you. That's really great, Kim.
Thank you. Thanks.
How about another tip?
Okay. Get up and move. Whatever you're doing, move. You know, I mean, you know, I use this little trick. It's 5, 4, 3, 2, 1, and launch myself out of bed. You know, because otherwise you'll say no. You'll make a bunch of excuses in your head of why you can't get up, or it's so warm in your bed, or whatever. But to get up and to actually do something and take care of yourself, you're going to feel better. So to get up and do some activity, and to put good food in your mouth, and to make conscious decisions of, you know, how you're going to feel after you eat that, and do you really need it, and just to make sure that you're getting active, because it's really difficult, right? Especially at this time.
That's exactly right. Get up and go.
Move.
2, 3, 1.
Right. 5, 4, 3, 2, 1.
5, 4, 3, 2, 1.
Like launch yourself out of bed.
I love that concept. I mean, you know, it's winter in most of the country, and the bed, like you referenced, is very cozy, so it's a little bit tougher to get up. But yes, definitely, it get up and launch yourself out of bed works on so many different levels, especially like individuals that have arthritic joints too. You need to get up and move. A sedentary lifestyle is not great. Your body will store fat if you're more sedentary, as opposed to when you're getting up and moving around. So it's really good for decreasing diabetes, because when you're moving, you're burning calories, and that's glucose. It's good for just bloodstream moving through your veins and arteries, so it's decreasing the risk of elevated cholesterol levels as well. And not to mention, if you work out, when you work out, you perspire, so that gets the heart rate up, it conditions your heart, it lowers blood pressure, and it's really quite refreshing to the skin too. It's a really great tip, Kimberly.
And also to get some accountability buddies, you know, to get your girls or your guys and that you work out with, and get a buddy, and to be accountable too, because it's, you know, you're accountable to yourself every time you look in the mirror, but when you got to show up for someone else, you know, it's a different story. So I always have my girls that I work out with, and, you know, to be accountable to show up for, and they keep me on track.
That's a really, really good point too, because that's with just about anything too. When you tell someone about a goal that you're about to achieve, you're holding yourself accountable, because every time you see that individual, guess what they're going to ask you about? What you told them.
Yeah.
And so that's very important. And a buddy, you know, it's holding you accountable and the other person as well. So when you tag team, it's really great. You can do a number of things, strength in numbers. So it's really good too.
Absolutely.
You got one more?
Yeah, and just to be positive, you know, and to stay positive, you know, happiness is a choice, and I choose it every single morning. Like, I have to choose it, and you just reset when you're feeling that dis-ease or that, feeling just ugh. You know, you just have to say, okay, I'm choosing this feeling, so I can choose differently. Choose again.
That's really good too. You have the power to make a difference, not only in your life, but someone else's life. It's a conscious decision. And really, to give someone a smile, or, now with the mask, it's hard to see the smile, so it's through your eyes, right? It's hope. And at the end of the day, that's what the world is missing, is hope and love, definitely.
Absolutely. And, be the difference, like you say. Be it.
That's right. Well, I really appreciate that, Kimberly. I do have a few more tips to give out. It's ways to invest in yourself. So it's on the boost your wealth side of things with this segment. And it's similar to some of the things that you were talking about, actually. And watch less TV, visit educational sites, read books. Save your money, invest in your money, love yourself. What a great investment, right? When you love yourself, you're going to make better choices and decisions. Be productive, learn something new, right? Plan your day and week. Some people are spontaneous and it works for some, but others need more structure. So when you sit down and you plan, almost like meal prepping too, it saves you money, and it saves you from grabbing something last minute that wouldn't be as beneficial for you as well. Practice gratitude. Measure your results, right? So you just can't do something and think, I did it, but measure it against something else. So it's almost like goal settings. Exercise, eat healthy, and wake up early, right?
Yeah.
So these are
and you're planning. So I say it all the time. People don't plan to fail; they fail to plan. So we have to have a plan.
Absolutely. Yeah. It doesn't matter how old we get. You're never too old to learn, and these are helpful tips to just instill in everyday life, so that you can hold yourself accountable at the end of the day and be proud of some of the things that you achieve. And it's not always major accomplishments. It's some of the little things.
Celebrate everything.
That's exactly right. Celebrate. Learn to live in the moment, in the present, and just know that your presence is greatly needed. Thank you, Kim. Next week is coming up. We have Dr. Green and Sharzad Green, and she is a PharmD. She's a compounding pharmacist, and she is going to tell all of us women about menopause, the types of supplements that we can take, why we're going through what we're going through, and she's just a wealth of information. I can't wait to have her on the show to talk about menopause in women. That is coming up next week. Thank you, everyone, for tuning in to Dr. Nancy Knows Radio Talk Show. Happy New Year, and we'll see you next week.
Optimal health requires you to perform at your peak potential. Start today. Be the change you wish to see in the world. This was Dr. Nancy Knows. Thank you for connecting. We're waiting for you on our next broadcast here at EMR, E-Motion Radio.